So this is the new unit. And for the scanner, this is for the hand pieces where you're using the high speed and slow speed the same place. And this for 3-way syringe. Okay. This is the drawer where we're keeping all the accessories. So here we have this is just micromotor. Yalla. The bottle for the clean water, for the distilled water where they use hand pieces, the same like the old one. Okay. This is also the suction is the same like the old one. Where you, this is the suction here, and the bottle is going behind. We have two. Don't misplace this one because while transporting, while we finish your job, you have to close this one. Okay. Oh, okay. So this is here. Okay. This is go. Yes. Okay. Yeah. And this is what? So this is connected. Okay. The 3-way syringe. It goes straight, just a coupling here. Okay. This one. This one. Okay. And there's a set of hand pieces. Here, the slow speed, which is marked with a blue color. Okay. Same way, we have the high speed, which is red. Okay. But in set, we have 3 high speed, we have 1 slow speed. Because they said they're using more high speed. Right. Go straight. This is the high speed. Okay, and this is the slow speed. The same. Okay. Of course, we have the controllers here. This is to control the water and spray for the for the scaler, and the other one for the high speed and low speed. And this is the common water control. You put off water or you put on water. That's it. 3-way syringe, suction. Okay.
And the pressure range up to?
This is indication for the high speed.
High
Pressure it will give you around 3 bar,
3 bar,
maybe.
okay.
Okay. This is for indication. One for the handpieces.
Handpieces.
It's not indication of the pressure of the compressor itself.
Yeah, that's it. Yeah, this one, working pressure for this one.
For this one, yes.
That means 3,000.
Yeah.
No, not air motor.
Not air motor, electrical motor.
Electric motor, okay. I thought it's...
Yeah, so you don't need much
Yeah, okay.
compressor.
Compressor
That's
power,
why
yeah.
the compressor
Oh,
burn is a small one.
Good.
We have power here. It's here. Sometimes other people they'll tell you my hand is big.
Oh,
I cannot put it here. This is a filter here. We can just remove this filter. This HEPA filter. And we can just put yeah. So we can put that one. It's a straight connect. Just straight there. Yeah, just lose it. Electrical connector. Just this is connector can come out anytime. Just a clip. Yeah. Just button. Tight this one. This is bottle is plastic and here plastic. Make sure that when you put it straight, it will go if you put little bit like yeah, but then you're spoiling the frame. Yeah, then later on it will start leaking. Just put it tight. Yes. There's a power switch here behind us. Oh, it's in front, sorry. Oh, okay. And, after build up, it will stop also. So you can operate the high speed handpiece. The first switch. This is the high speed. This is slow speed. The high speed, the other one. Just you need to change the yeah. Sorry. So this is the slow speed and this is the high speed. We need to change. We have other model also which you can use the turbine, which is a little bit more expensive and little bit more heavier. So the comment of the doctors or end user that's they need light. Yeah. So this is the high speed. It's a similar and everything, but little bit maybe sometimes you may tell me the mouth of patients, especially kids small, but I think you can do the purpose. So you have scalar, high speed, low speed, 3-way syringe. 3-way syringe the same, we have the syringe and you can, yeah. Okay, this is off, so when we're off, there's no spray in the handpiece should be. So that's it. This is the suction. Very, very powerful suction. Maybe this one is better than the old one. It's more powerful. And this
with the motor?
sorry?
It's working with the motor or air?
Motor and air. There's a motor with a venturi. It's more powerful. And there's a control also here where you can increase or reduce the suction power. Okay. It depends on your requirement. You can go to maximum. mainly. The rest we have chair, stool is the same common, the old one. There's no change on that one. And there's a light, so I'll show you the light and the stool. We have two stools.